So we're going to start off with the top part of the skull. I'm going to move this part of the way, and we have the top part. Now, this top part of the skull is actually divided based on the sutures, as you can see over here. And there are several components that you actually have to know. Now, from an exam point of view, it's not clear whether or not the skull will be divided in two halves, as you see over here. But suppose this portion was taken off from the rest of the skull, you'll have to identify first the bones as well as the sutures, as you can see. This part over here is known as the frontal bone, and on the sides you have the parietal bones. The two parietal bones over here are actually divided by a suture, which I'll get to shortly. As I turn this skull sideways, down here is actually just a small section of the temporal bone. That you see here is actually a suture. So the complete view of the temporal bone you can appreciate if I just put the top part of the skull back with the rest of the skull. And you can kind of get the idea that this is the temporal bone. Now as I turn the skull around, you then come across the occipital lobe, the occipital bone. So do note that we have the occipital bone, the parietal bone, which is 2 in number. You also have the temporal bone, 2 in number, 1 here and 1 over here. And then looking from the front, you have the frontal bone. The next thing you want to identify are the sutures. The best way to know the sutures is to go based on the bone that they're usually associated with, to where they connect. So I'm going to go ahead and take the top part of the skull off and go specifically and point out the sutures. Behind the frontal bone, you're actually viewing this part right now anteriorly. Behind the frontal bone is the coronal structure. The coronal structure over here divides the frontal bone from the 2 parietal bones that are behind it. Now, if I hold the top part of the skull sideways, right now you're looking at it from posterior to anterior. Now, these 2 bones, like as I mentioned earlier, are the parietal bones. The 2 parietal bones are divided by the sagittal suture. They also are divided by the coronal structure. If I turn the skull around, looking from the posterior aspect, we then come across the occipital bone. The occipital bone is divided by the lambdoid suture. The lambdoidal suture, as you can see over here, is dividing the parietal bones, 2 in number, as well as the occipital bone. So just to recap on the sutures, we have the lambdoidal suture, and then we have the sagittal suture, and in the front we have the coronal structure. In relation to the temporal bone, there's another suture on the lateral aspect of the skull. This is referred to as the squamous suture. You'll see them on both sides, on the left side of the skull as well as the right side. This is in relation to the temporal bone. Here's the second squamous suture as well. In relation to the occipital bone, as I turn the skull around, you'll notice that there's a large opening. These large openings also referred to as foramens. This is going to be hard to miss. This hole right here is referred to as the Foramen Magnum. Now, adjacent to that Foramen Magnum over here are the occipital condyles. Another important thing to know in relation to the occipital bone, which is over here, looking at this posteriorly, is that the occipital bone also has something called the external occipital protuberance. If you actually feel the back of your head right now, you can kind of feel this bulge and that bulge is known as the external occipital protuberance. So again, in relation to the temporal bone, looking from the lateral aspect, from top to bottom, I'll go over the structures. Like I said earlier, this is the squamous suture, which is essentially dividing the parietal and the temporal bone. Now, as you work your way down, the next process that we're going to see here is the zygomatic process, which is this part right over here. This is the zygomatic process. Another thing that you also want to point out here is the external acoustic meatics. The external acoustic meatus is in relation to your ears, but where I'm pointing to over here is the external acoustic meatus. Now, as you go further down, we come across another structure. This is the mastoid process, which you'll see in a bit. This is actually in relation to the maxilla. And lastly, we will also come across the styloid process. So here's the mastoid process, but over here, as we look inside, that is the styloid process. The styloid process. So definitely make sure that you can distinguish the two: mastoid process, styloid process. Mastoid process, styloid process. So now on to the sphenoid bone. Now, in relation to the sphenoid, the first thing you want to look at, you want to be able to tell where the lesser and greater wings are. The lesser wing will be where my pen is on top over here, whereas the greater wings will be below that. That is referred to as the greater wing of the sphenoid, and on top of that you have the lesser wing of the sphenoid. A few other structures that you have to identify for the sphenoid include the sella turcica. The sella turcica is actually right over here, where the pen is showing. That is the sella turcica. And the optic canals, they're not hard to miss. They're actually, there's one here and one here. Now, what traverses through the optic canals are the optic nerves. So just make a note that on top, the topmost holes are actually the optic canals. Now, this hole over here, you also have to identify. This is referred to as the Foramen Ovale. There are two in number, one on either side. Foramen Ovale. Now, obviously, this is not the best model, but in relation to the ethmoid bone, we have to identify the crista galli, the perpendicular plate, as well as the cribriform plate. The ethmoid bone can be further subdivided into the cribriform plate and the crista galli. The crista galli would be this crest that you're seeing on top over here. That is the crista galli. So when you think of crista, you can think of crest, crista galli, top part right over there. Now, the cribriform plate is more flat-like, so the cribriform plate will be situated behind the structure, so it's going to be the flatmost part behind the crista galli, and that's referred to as the cribriform plate of the ethmoid bone. And the third structure that you also want to know now here is the perpendicular plate. And now the perpendicular plate is going to be appreciated in two ways. It can be seen in the front as well. Just a correction over here, the perpendicular plate is a thin vertical plate. This is extending into the nasal cavity. So this structure right here that I'm pointing, that is the perpendicular plate of the ethmoid bone. Just be careful, because this structure does continue on into something else as you go along, but just know that the anterior aspect of this is the ethmoid, is the perpendicular plate of the ethmoid bone.